All right. Hey, everybody. Hey. Welcome back to another episode of the Pelvic Perspective podcast. I am your host, Dr. Joan Michelle Martin, owner of JMM Health Solutions and the Pelvic Perspective. And today I have with me just the most amazing human being. She is a mom of two. She is a physical therapist, a preeclampsia survivor. She is a clinical assistant professor for women's health. She's a VBAC certified doula. Y'all getting the gist that she's wearing a lot of hats here. Dr. Katherine Sylvester is the owner of Operation M.I.S.T, and it's an organization where healthcare providers teach women how to use smart devices for safer pregnancies to really impact maternal health outcomes. And she's been doing this since the pandemic, y'all. She's been doing amazing work. Her Misties are what the group of moms are called, which I absolutely love that name. Just are women in all stages of life. And she's really even gotten to the younger generation to start just introducing them to what healthy bodies look like through period parties and all just these amazing things. So today, Dr. Sylvester and I will be talking about just monitoring and really the fact that the solution is in the data. So without further ado, hi, beautiful.
You are beautiful, and I'm so excited to talk to you as always. Thank you for the beautiful introduction, but more so than that, for having this platform and for everything you've done over the years to make this space, the birthing space, a beautiful place to birth, to exist.
It needs to be. It needs to be. It's something that is, it's so interesting because something that should be so normal, right? Like you think, oh yeah, we get pregnant. Like our bodies are designed to do that. Yeah. Something that is so natural, so normal, so, just physiologically innate has turned into something that is so medicalized and something that has become very scary for so many. And it doesn't need to be that way. And for anyone listening, understand when I say medicalized, there is a place for modern medicine. And by God, I'm glad we have it, right? I'm glad that for those individuals who need that additional care, they have that.
Right.
But for the average pregnant person, they're not symptomatic, they're not problematic. Right. It should be a beautiful and joyous experience. And it's really come a long way away from that. I love what you guys have been doing in the monitoring space. So tell us a little bit more about that and just why it's so important for moms to know this information.
Yeah, so I will start with my story. So following the delivery of my child, my sweet daughter, my blood pressure shot up sky high. I was in and out of the ER, and I was told, to take it easy. Essentially, that's what I was told. After I delivered my baby, it was like, well, take it easy. And take it easy is really relative. It depends on how many other people are in the house to help you, what went on during your pregnancy, when you have to go back to work, what your house setup is like. And a lot of times people don't take that into account when they're giving advice. And so following the delivery of my daughter, I really did need to take it easy. And for a person like me who normally wakes up at 5 a.m, then I work out, then I make breakfast for everybody. And then we start our day together. And because I was on maternity leave, that meant I got to be with my kids all day long. So we're outside, we're playing, we're doing everything together, make lunch, make dinner. After they go to bed, I get some work done. That's what a normal day would look like for me. But since she said, take it easy, I woke up a little bit later. I only cooked 2 meals instead of 3. I'm scaling it back, but really had no objective way to say what was happening within my body on a consistent basis. And so a PT sent me a watch because they were trying to see, can we use wearables to detect COVID? And it turns out, of course, that you can, but I wore the watch all day, every day, because it was part of the research study. But that's when I started to notice that I would walk a 1/10 of a mile and the watch would alert me that I was in distress. And then I would check my blood pressure and it would be really high. And I'm thinking, man, as a PT, as a healthcare provider with the American Heart Association, people are saying, get out, get a 20-minute walk in every day. Just make sure if you're bleeding that you go back home. It's good for your mental health. It's good for the baby. You need the vitamin D. But the fact of the matter is, everybody needs something different. And when I was a 10th of a mile away from my house, I needed to go back home. So that meant 10 times a day, I was doing a 10th of a mile. Not that I was doing my 20-minute walk all at once. And when I realized that the watch could really give me more insight into how my day-to-day decisions were impacting my ability to heal, it made all the difference. I would eat cucumbers, tomatoes, boiled eggs, and the stress would be through the roof. And it clued me into the fact that maybe the heart healthy diet wasn't enough. So I got onto a kidney friendly diet. I was able to refer myself to people that I realized I needed, that I didn't know I needed, that my healthcare provider didn't tell me I needed, but I needed a dietitian. I needed a different MD who specialized in obstetrics and gynecology. I needed that PT who was initially watching me for COVID to now reach out and be like, hey, what's going on? How are you sleeping? She really helped me. I love breastfeeding. So overnight, I wanted to wake up, breastfeed, just like I was doing during the day. And she was like, Katherine, give your body 5 hours. If your data doesn't improve, if your data doesn't change, then go back to waking up in the middle of the night, right? But she knew what was going to happen, right? My blood pressure was going to be lower. My heart rate was going to be lower. And so it was just, once you have the objective data, it helps you make decisions differently. And so now I make data-driven decisions for everything. And that's what I want women to do as well, regardless of what phase of life we're in, right? Because if you look at the statistics surrounding preeclampsia survivors, 10 years down the line, they're at higher risk for having chronic kidney disease and kidney failure. And then you think about women who are dying 20, 30 years down the line of heart disease. I feel like the reason those things are happening is because we don't change anything. Once the scare of preeclampsia is gone, blood pressure is back normalized, you think, well, I'm fine. When in reality, you could do interval training in terms of exercise instead of really getting into the cardiac zone, right? You could really keep your diet to where you're not taking in as much meat-based protein because you know that that's harder on the kidneys long-term. And so what decisions can I make now, day to day, that are going to help me from a health perspective later on? And the watch just helps. It just helps because when you see, the neat thing about this one is that there is orange for fight or flight and there is blue for rest and digest. And so if I eat, let's say, and I'm not a bacon person, but let's say I eat bacon in the morning and then I eat lamb for lunch and then I have steak for dinner, even if I pair that with vegetables, stress is going to be high even through the night because of how long it takes for the body to process meat. Yeah. And so for people who are, I am not saying that everyone needs to be plant-based or everybody needs to just go vegetarian, but what I am saying is knowing how the foods that you put into your body are impacting your body makes all the difference in the world. So the monitoring has done that for women. It has allowed them to take control and not have as much stress on themselves as they would prior to putting on the watch. And then it's done in community. So if you think you're just going to go down the road and not make any changes, somebody's messaging you like, hey, your stress is up today. What's going on? Or you're postpartum, but you're only getting 3 to 4 hours of sleep. What can we do to make sure that you're sleeping more and that you have good quality sleep? Because it's not just enough to say, oh yeah, well, I am sleeping 8 to 9 hours. If one of those hours, only one of those hours is quality. And so we've been able to help women not only make changes for themselves, but then their partners, their support people can also check their app. And so we've had guys, set up a vacation, right? So the most recent thing, he set up a vacation for his wife because it was the end of her pregnancy. And prior to that, he stopped her from working. He was like, look, you don't need to work. Your stress is high. You're not recovering very well at night. You're working it's just too stressful. She stopped working. She got pregnant right away, goes through Operation M.I.S.T, has her baby. He's checking her app when it's time to go back to work. He was like, you're not ready. You're not going back to work. Your body is not ready. And so he took on a second job so that she could stay home. Wow. And so, let me tell you the other part. So a couple of weeks ago, he checked her data. He was like, it's time to go back.
It's time to go back.
You're fine now, right? And so it's just really watching teamwork happen. Because I feel like in this, a lot of the guys that we talk to, they say this, they're not pregnant. They don't know how to help. They don't know what's going on. But when they can see objective data and say, wow, I did the dishes for her last night so she could go to sleep, And instead of her body being recharged 20%, it's recharged 60%. They do dishes every night. Or they wake up in the morning, they check her stress. And the thing I was going to tell you about the vacation, he said the vacation for them, when they got on vacation, they were supposed to take full advantage of Great Wolf Lodge. And if you're not in Georgia, you may not know, but this is a water park, like sun up to sundown. You and your kids can have an amazing time. He left her a note when they woke up for the vacation. He said, your stress is high. I'm taking our oldest to the water park, but you stay in bed. And when we get back, maybe we'll do movies today. And then we'll reassess tomorrow and see what we should do. And
Wow.
so it's like, we're not just going to take advantage of this because I paid for it. It is what is best for your pregnancy. Right. It's just been amazing. It's been amazing.
I mean, if every dyad was like that though, oh my gosh, that is so beautiful because, you know, for one, we as a society have gotten away from the parent unit. We've taken dads out of pregnancy and birth. We've taken dads out of families, right? And we know the research on that. We know that when dads are not involved and dads are not present, then it does considerable harm, or it really negatively impacts outcomes. And to have the dads be able to feel like they fulfill a role. And I mean, like, you know, men and women think differently, but you know, when you were saying that, I was laughing because I had a client who was a birth client, and we're in the hospital, and dad, you know, like I'm working with her, I'm getting her to relax, and dad is like, I kind of feel out of sorts. I said, no, I want you, remember, this is where you encourage her. You have a role too. I'm just navigating the big things. But remember, at any time you feel free to step in, right? That's your wife and your baby. And he was like, okay. And then he turns and he realizes, he's like, what is this? And I said, because at that point in time, she was being monitored. And he goes, okay. I said, and this is a contraction. Oh my gosh. He latched on to that machine and he says, okay, the tape needs to be torn off. I said, well, they have it on the screen and most of the time they come in, they really don't use it. So tell you what, tear it and put it on the side. When the nurse comes in, you know, you just let her know. He's like, well, nurse, here's what I've been seeing. And she was the sweetest person. He's like, here's what I've been seeing. And then he turns around and he goes, by the way, do you need those? Because I'd like to keep those for my records.
Right.
But it was but he just felt like, I can see what's going on. I know what's going on. And he's the same thing. Babe, I need you know what? I need you to chill out. Because she was like, well, I want to get up and sit down. No. Let's change position in the bed. Let's do this. Let's get up slowly. Let's see what that looks like. And wow. I mean, it was so interesting. I mean, she probably wanted to be like, I need you to go sit down somewhere. but it was so beautiful to see, because all he thought about was, I just want to do what's best for you and our kid.
Yes.
That's it. And yes. You know, you can't beat that.
No.
When it comes to, you know, we know, for those of you listening who may not be aware, when we talk about preeclampsia is one of the hypertensive disorders of pregnancy, right? So it's not enough to just have high blood pressure, because you can just have gestational hypertension. But with preeclampsia, there usually is or can be a neurological component. There usually, and if it gets to be pretty intense, that's where we get eclampsia from. So now we get into potential for seizures and strokes, and or there is an organ failure component. So now we get kidneys and liver specifically that are involved there. And so this is something that is typically seen around week 36. So you could be having a otherwise normal pregnancy, everything is healthy, everything is good, and then all of a sudden that blood pressure just shoots up. With the monitoring, how has that really been beneficial? Because, you know, you hear stories of people going to the doctor and doctors just saying, well, your blood pressure is high, we got to induce you. No context, no nothing, right? Or people, you know, are like, well, I don't feel good. They go to the doctor and the doctor's like, you're fine. And then God forbid something ends up happening. So how has utilizing the monitoring really helped individuals to take charge of their own healthcare?
I love that you said that. And I have an example of when issues were averted versus where an issue was run into, and then she was able to use her data to advocate for herself. So we had a mom, and we ended up detecting her preeclampsia at week 30. And so in terms of pregnancy, you expect that, and it's just general though. So I don't like people to think if this doesn't happen, then something is wrong with me. Or if this does happen, everything's going to go perfectly. But what we generally expect is that resting heart rate will trend upward. And depending on how in shape you are, it could trend up really fast, or you could just go up a few points over the course of the pregnancy, right? But the body's ability to adapt to stress is a little bit impacted. And so you see that difficulty shifting between fight or flight and rest and digest. You kind of see that over the course of the pregnancy. And so anyway, in this mom, we saw a general improvement in her data, which is a little scary, right? Because you don't want things to look bad, but you don't want them to look really good either, almost like a miscarriage would look. Mm-hmm. And so in this mom, her data gets better. And she also, though, told us that under no circumstances does she exercise. She's not interested in exercising. Don't talk to her about exercise. So when we see some exercise looking activity, it was an immediate reach out. Hey, what are you doing over there? And she's like, oh, I had a provider come. They put me on a birthing ball. So she's telling me about all the stuff that she did. And I said, well, is anything else going on? How are you feeling? And she said, well, my blood pressure's up a little bit. Her blood pressure was 120 over 80, but it was up for her. She's 90 over 60. So she called her provider and they told her, just stay home. You're fine. We'll see you in 4 days. So you just put your feet up. That's what they told her, put your feet up. Well, she works about an hour away from home. She works 10-hour days. She has 2 kids that she has to drop off. So there was really no putting your feet. I felt like I was her. But if someone had caught it in me earlier, then maybe I wouldn't have run into the severe form of preeclampsia. And so when she said that, I said, I need you to just go in. Because if you go in, I'm sorry. So the conversation ensued, and she was telling me that her legs feel like elephants. She's peeing every 2 minutes. Like she feels like as soon as she sits down, she has to get back up and go again. And, just the classic, something is wrong, right? And so I said, I would like you to just go in. And that way, if you get checked out and nothing's wrong, they'll just send you right back home. So she goes in. And by the time I told you it was 120 over 80, by the time she made it to the hospital, it was 140 over 93. So it had already jumped up significantly. And they admitted her immediately, diagnosis of preeclampsia, put her on magnesium, got everything settled down, started her on something in case the baby was born to help develop the lungs faster. And so they did all of that, but they sent her home with no blood pressure medicine. They were like, we just feel like this is going to get severe. And when it does, you just come back in here. And we can't really guarantee that what's going to happen. We don't know how quickly it can progress, but there's nothing you can do about it. So just go home, take it easy, and then we'll probably see you in a week or 2. That's what they told her. So she calls, of course, crying. Her husband is like, what can we do? And I said, well, here's my suggestion. If we can keep your stress levels down, then maybe we can have a better outcome than what they're saying. And then we also need more objective data. How much protein are you pouring? They didn't do a 24-hour urine collect. They didn't refer her to any other provider other than them. No kidney doctor was on board. It was just, there was no attempt to improve her outcome. Because if you look at research, there's nothing to do about preeclampsia, right? It's just the delivery is the answer. That's what is said. But what I will say is that what we have found is that even though the placenta will send off, so what it's theorized that the placenta is sending off these signals and it's causing the blood pressure to go up. So there's no way to decrease the blood pressure, right? That's what.
Hold a second. I think we lost you there for a second. So I got you at even though, so they had told her, just to recap for anybody that lost us there for a second. So this mom was sent home. She was not connected to any other providers. They didn't do any other specific testing on her, nothing of the sort, but just based on the evidence, we know that if we can at least keep her stress down, we can make a change. So,
yeah. So I talked to her husband and I said, can we do maternity leave now? He was like, yes, 100%. So she calls her job, no more driving an hour, working 10 hours, right? So she completely cut that out. We knew from tracking her that, or helping her monitor, because it's not just us watching, it's the mom watching too and seeing, okay, what's driving my stress up and things. So for her, it's clutter. And so he was like, okay, then it's a hotel. We do a hotel for a few days, kind of let her body settle down. She's not going to see all the clutter going on in the house. We're going to do that. So they did that. They changed their diet. So she was doing a lot of meat, changed over to a plant-based diet. He was like, if she's doing it, I'm doing it. He completely cleared out everything in the kitchen, went to a Whole Food store, bought all the foods that she thought she might like. Every now and then she would eat meat, but not meat, right? So did that, because at the end of the day, while the placenta can drive up blood pressure, or a problem with preeclampsia can drive up blood pressure, there are so many factors that can help manage blood pressure, right? So I'm just like, let's not give up hope. Let's manage blood pressure in the way that we know we can. And then the sleeping. She was sleeping 9 hours a night. When I tell you, she went on to deliver at 37 weeks. So no complications at all. Baby is perfectly fine. And even her medical team was surprised. And it's like, it really shouldn't be a surprise. We have to try something. We don't know what's going to work, but let's try and then see what her data does. And so that was her story. And I love that her and her husband were able to work together as a team to have a better outcome. And he's like, if she's doing it, I'm doing it. So that's the end of that. And they did it together. But we had another mom. So she actually delivered her child, her sweet baby. And after the delivery, she could not stand up and she could not walk. And so that's red flags for all healthcare providers, right? At a delivery, cannot stand up, cannot walk. So her blood pressure was like 90/60. So blood pressure had dropped. That was not normal for her. She, and then they told her, we'll just put a catheter in. Since you can't walk right now, we'll just put a catheter in, Foley catheter. So you could use the bathroom, roll for the bedpan if she was to need it. And so it was just an ignoring of that there was something wrong. So I said, you should just ask them to check your hemoglobin. I mean, it doesn't hurt to check. And she was like, well, they're looking at me and they're saying that I look fine, that I look fine. I said, right, but there are numbers. Right. There are numbers that you can objectively check. You can objectively track blood loss. So why not just go down that line before you're trying to discharge someone from the hospital? So they refused the hemoglobin check initially. And they were like, later on in the day, if you're not feeling good, we'll look into it. So when she asked for a hemoglobin check again, they said, well, we'll just give you iron. If you're not feeling good, we'll give you iron. And for anyone listening, while iron does help you eventually get to a higher hemoglobin number, right? It's not immediate. And so you need to have a solution before you go home. And for this particular mom, we go and we drop them off snacks and stuff when we know they're going into the hospital. And so her home, the distance from her car to her bedroom was just, if she had blood loss and she made that walk, I don't think she would have made it. That's the best way that I can describe it. So anyway, going into the delivery, her hemoglobin was about 13. When they finally agreed to check it, because they were trying to get her to sign discharge papers the next morning. And I called her and I said, listen, your heart rate is up. Your oxygen is down. Your blood pressure is still low. It is higher, but the body is going to compensate, right? The body's not just going to be like, oh, it's 90/60. No, it's going to compensate. So yeah, your blood pressure is a little bit better, but you don't look like you just had a baby. I'm expecting a huge improvement in your resting heart rate, huge decrease in your stress and your body's ability to bounce between the two. Like she did not look like she had delivered a baby. So she was like, you know what? I know I don't normally stand up for myself. She's like, but I'm going to do it. I said, yeah, you have to do it. It's no option. I would be calling the doctor on your behalf if you don't do it. So you could just do it and make it easy for all of us, right? So she talked to the doctor and she was like, look, I'm not going to leave until you check my hemoglobin. And so at that point, of course, they don't want her to stay. So they checked her hemoglobin. She was at 5.9. They were like, we are so sorry. Went ahead, cross-matched, typed, whatever, got her the blood transfusion that she needed. Yes, and got her to stable numbers before she left the hospital. But can you imagine?
She wouldn't have made it getting home. You're talking about walking from the house to the bedroom. I don't even know how she would made it to the house.
Right. And she has a toddler.
And she's got a toddler.
And her husband works. And I mean, it's just, there are so many things that the data helps women say something is wrong. I'm going to keep pushing it until someone investigates. I don't care if it's the janitor. I'm going to need you to tell everybody, unless you're going to leave that hospital, I need you to tell everybody there until somebody takes your symptoms seriously. And that's really been the biggest difference that I've seen in women, especially ones who have come on and they say, you know, I really was not hurt my last pregnancy, or I got forced into a C-section, or they called me in to be induced and I just went because I thought that the doctor knows best. And a lot of providers do know a lot. They do know, right? They do know best. But you have the data that you can give them to make better decisions. I always just try to get people to understand. And I heard this OB say this the other day, and I thought it was the most beautiful thing. She said, when we come together, expert of the subject and an expert of self, that's when the best decisions can be made. And that's what I think we're giving women. They are able to now be the expert of themselves. So if a doctor looks at their blood pressure and says, oh yeah, that's a good blood pressure, then you can say, well, that's not my baseline blood pressure. So can we look into it? And from there, if he says, well, no, I really don't think so, based on our standards, based on protocol, we look into it when you're at 140/90, then you can make the educated decision to go to another provider who will look into it. And so we have to really get comfortable going to someone else. And I think that the reason that women are feeling a little more comfortable is because now they have data. No one can tell them, no, you're tired because you're pregnant. Everybody has, you know, a hard time going upstairs when they're pregnant. Yeah, but does everybody have their heart rate at 160 when they're doing it? No, right? And so if someone's entire pregnancy, they've been between 60 beats per minute and 120, then it would not be expected that following delivery, all of a sudden you go up to 160, right? And so that's how we caught fluid overload in a mom. She was at home. She was very upset with me. If you ever listen to her podcast episode, I did not think she'd be talking to me to this day, because you're a mom. I'm a mom. No one wants to be separated from their baby at day 2. Nobody, right? And so at day 2, when we saw that her data did not improve, we were like, you got to go back. Got to go somewhere. I didn't say the hospital. I said, why don't we just start at the med stop, you know? So let's go to the med stop, see what's going on. She goes to the med stop. They did an EKG on her. They were like, we have to get you to the hospital. This is completely abnormal. Get her to the hospital, did an echo. That's when they found that she was trending into fluid overload, heart failure. Her doctor looked at her and was like, I would have given you 3 weeks at home. 3 weeks. Wow. That would have been it. And, you know, you think about women who die day 4 at home from heart complications.
Well, even just the notion of, birth is preventative for preeclampsia. We know that's not quite true, because there are a lot of people who may or may not have signs, overt signs, before birth, but the first 6 weeks after birth, then something happens.
Yes.
And that is such a critical time. So, I mean, even as I'm listening to this, just even that postpartum period, those first 6 weeks are so crucial. And that's where we lose a lot of mamas.
Yes.
We lose a ton of mamas in that period. And the sad thing is, it can be helped. Yes. I can't tell you how many mamas have been, you know, you tell them you need to reach out to your doctor. Something is not right. And they get the nurse's line, or they get a nurse telling them, well, if you feel like something is going on. I had a nurse they called the doctor's office. I laugh at it now. Uh-huh. I laugh to stop myself from saying words that aren't really appropriate, because the nurse told her, well, if you feel like something is wrong, just go to the hospital, just go to the ER. But what is stopping her? And she didn't live far from the doctor's office. She lived further from the hospital.
Yes.
What's stopping you from saying, you know what, you live just down the road, just come in real quick. Let's run some tests, do some blood work real quick. And then if we need to send you on, we can send you on.
Yes. 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 But you know, that's happening more often than your story, right? It just happened 2 or 3 days ago. And this mom, the sad part is that she didn't even realize how offensive it was that her provider did that to her. And so after we had a conversation, I said, you know, why did you choose this place? What made you say, this is where I want to give birth? Because for her, she started bleeding at about 10 o'clock at night. She reached out to us, we troubleshooted, and just because of some other things with her. I said, you should be able to go into your provider in the morning and then they take a look at you. So she calls in the morning, provider doesn't answer, doesn't call back. This is a 24-hour line, okay? Because she had called her too the night before when she called us, and no one answered. And so at that time, I said, do you have something that is the equivalent, like where you could go and just get an ultrasound of your baby? You just pay for it out of pocket. And she didn't know. So we looked it up together, and it was about 30 minutes from her. So she's on the way there. And then her provider calls her at like 12 noon. So all the time, like, didn't call her till 12 noon. At 12 noon, she was like, no, I'd rather you go to the ER. And I said, well, could you ask her if you could just go to her? Because they're just checking to make sure there's a heartbeat. Wow. And so I just thought, as a provider, I would never think to send a mom to the ER where you don't know how long they're going to wait for an ultrasound to be done. You don't know how much time they have to check on this baby and just make sure that it's still breathing.
And depending on heartbeat, a lot of emergency rooms tend to be very dismissive of pregnant people because there's not an OB in the ER.
Right.
Not all hospitals have an OB trained physician in the ER who is there in the event that a pregnant mom, regardless of the stage of pregnancy, comes in.
Yes.
To appropriately triage a lot of these things. So then they get sent home. Yes.
And so it's absolutely. And it's happening too often. And the neat thing is, I've met such amazing OBs over the last couple of years who, when they see that something is going on, they act immediately. So it's not like it can't be done. Yeah. It is that people are choosing not to do it. And then, of course, for us, we don't want to have to push back all the time. We don't want to have to fight while we're pregnant. And so it ends up being a case where instead of us fighting, we just are like, well, we just hope for the best. And we can't do that. We cannot hope for the best. We prepare, and we investigate early. And that way, if something goes wrong, then a minor issue can remain a minor issue instead of turning into a preventable and major complication. And so that's the understanding that we have with all of our moms. If something comes up, you're going in, or if something comes up, we're investigating, because some of the times it's not that, anything terrible is happening. Sometimes it's Carabas. We had a mom, we were tracking her, and we knew that her data got really bad when she went to Carabas. So we made an agreement, a pact, that she was not going to Carabas her entire pregnancy. And she was good up until about week 37. And she didn't even tell us that she was going. So sometimes now they'll message and be, oh, girl, yeah. And you know how that is. We don't play about hiding information, right? One mom, she's taking a road trip today, and she messaged me. It was like, my dad might be bad. You'll be on the road, not eating good food, like stress. The ride does increase her stress. But it's like just giving us a heads up, right? Mm-hmm. So she goes to Carabas, then goes to her doctor's appointment. So the doctor is like, your blood pressure is through. The baby's already full term. Let's go ahead and get this baby out. We need to schedule your C-section. So she calls me afterwards crying. Oh my God, went into the doctor, my blood pressure up. I was like, wait, why was your blood pressure up? What happened? But tell me about your day. What happened between this morning and when you went to the doctor's office?
See, what had happened was
that's exactly what she said. I said, listen, because a lot of people are like, doctors just want to rush to have a C-section. They want to rush to induce. Well, sometimes if you give them the right data, they're like, I'm trying to avert this complication, right? If I am trained to prevent bad things from happening, when I see bad things start to happen, I am going to intervene. It doesn't always have anything to do with the way I look, the color of my skin. Like sometimes it's the data that's being presented to them says, let's intervene. And so with this mom, I said, drown yourself in water tonight. You're getting sleep. You're doing all the things that you know to do. When you wake up in the morning, you're going to go for a walk for me. I need you to take your blood pressure and then send it to your provider and see what he says. And also admit to him that you had Carabas before you went to your appointment yesterday. She went on to deliver 4 weeks later, like just perfect baby. But it's like, sometimes you just need somebody to reach out and say, okay, let's troubleshoot your day. Is it that you stayed up all night, that you took a long road trip, that you ate differently? What is it that's impacting your data? Because sometimes, like we presented at the National Institute of Health last year, and the first question that came up was, well, how high do you let the stress go? How low do you let the oxygen get? And it's like, it's just not about that. It is, we're looking at the person as an individual. We are looking for a deviation from what's normal for them, but then we ask questions to help troubleshoot. And then from there, if it's something that can be, modified, then we wait for the data to get better. So they change, and then we look at the data. And then from there, we help them make a decision. It's not always, let's run to the ER, right? It's not always, I need to go back in and see my OB. Sometimes it is, what can I do in my lifestyle to improve my outcomes? Because what we're finding, I hear so many people fighting for women to get longer maternity leave after birth. My argument would be, can we start maternity leave at month 8?
Can we start it at 8 months?
Can we start it at 8 months? Because that's when the body really has a harder time adjusting to things. That's when that's when we're finding women are calling their employers now, and they're like, hey, is it okay if I work remote for the last month of my pregnancy or 2 months of my pregnancy? And they're being told yes, because they have the data to support it and they're good employees. Why not? Right?
Why not?
And so,
you know what's funny about that kills me though, is when people will say, well, back in the day, women worked, they out in the field, and yeah, that may be so, but were they also dealing with many of the stresses that are happening? I mean, every time presents a little bit differently, right?
Absolutely.
Like driving, the commutes nowadays are horrible, right? Like there's the work stress, environmental stress. The food is definitely not what it used to be.
Right.
I mean, like, can we get a vegetable that does not come in a can?
Okay.
So like when we start considering all of these things, like you have to have some sort of leeway and provision for, again, I always tell people when I do doula trainings, I'm like, listen, y'all, we are not anti the healthcare system.
Right.
Doctors do not get up in the morning and say, I'm about to wreck somebody's day and just let some folks die. That is not what they say. They really do come in with the belief that we are going to save lives. But like you said, they can only do what they can do with the information that they're given. Mm-hmm. And then they're going to try to make the best choice given that information. So then we've got to look at what other things we can do to help the situation. And granted, you will have every now and again some doctors who are just like, we got to pray for them. But, ultimately, what are the things that we can do to alleviate the stress? We know end of pregnancy around month 36. And like you said, your young lady had preeclampsia starting as early as 30 weeks. It can start as early as 20.
Right.
According to some research. So if we know, hey, we've got these risk factors, hey, we're starting to see these trends, why then are we not pushing for this? And if you're an elected official and you're hearing this, yes, this is your job. Like, we need to make some stuff happen. Okay.
Yes, absolutely. And I love how you said it's not an apples to apples comparison. It is not. I think about all of the conveniences of this life, of this world, and it has really made for a more sedentary population. And so, yes, if someone was working the fields their entire life and their entire pregnancy, then that's nothing different than what they were doing before. But if someone goes from having a desk job to now being pregnant, where at week 20, our heart works harder, our kidneys are working 50% harder, it's a completely different marathon. So it's like having someone who's only ever sat on the couch to then go run a marathon. People would look at them as if they were crazy. You can't do that. And yet they look at women and expect that we can and that we should. And I think, a lot of times, because I do love the monitoring, I love the watch, but my heart, it connects us to women so that we can be that community. It is about the data, but it's also about how can we intervene and make this birthing experience safer? And so if someone, when you said the mental distress, where we do our granted work in some rural areas in Georgia, we work with ladies who don't always have the resources that they need to have a healthy pregnancy. And so my thought is that, you hired me to come in and monitor and figure out what's going on with the mom, but I'm also going to need some help to meet those resources. Because if we find that she's not sleeping well because she's sleeping on the floor, we need a mattress. Or there was one lady who came to us and a tornado came through her town. And so she lost her house and then she lost her car. And then because she couldn't get to work, she lost her job. And then the next day found out she was pregnant. And so you think about, what does that pregnancy look like? What does her mental health look like? The weathering, the constant state of stress and trying to make sure that you survive. And then knowing that now I have to take care of another human being, that is hard. And so my job, our job as Operation M.I.S.T is to connect with people in the community who provide housing, transportation, clothes, food, car seats. Like, some people are afraid to get pulled over. They don't have car seats for their children. You are operating in an it's just stress all day long, day in, day out. Can't sleep because in the apartment next to you, a stray bullet hit 12-year-old girl. Like, it's so much stuff that goes into the pregnancy experience. And so what we love is being connected so that we can then connect them to the resources they need to actually be able to thrive. Because it's just not about carrying a baby. It's about everything else that's surrounding you that can either make it difficult or easy for you to go through the process. And a part of that, of course, is not all of those social determinants of health that we're talking, but just health in general as well. It's like, can we get hemoglobin A1C checked before we even start thinking about getting pregnant? Because we know that women can be at a higher risk for gestational diabetes. So if we know how they're managing their sugar pre-pregnancy, then we can help them get in a better position for pregnancy. Resting heart rate. If you're resting at 85, and I'm not nothing, I know that the norm says 60 to 100, but what I'm telling you is, if you start out pregnancy at 85, you're not going to feel good when you're at 105, 110 resting. Okay. And so we get their resting heart rates down a little bit. And that's why I love the pairing of our PT brain with the remote monitoring, because then we can look at the data and say, okay, this person has high blood pressure and they're on meds. Can we get them off of meds before they get to pregnancy? Because we know that the pregnancy does give you a little bit of a dip in your blood pressure. And so that's a good offset, right? But if we can get them to where they don't have the blood pressure management problem before pregnancy, because we know what happens in those first 6 weeks following delivery, where the blood pressure is not regulated as well, especially for the first 2, then we can get them in a better place, get them better prepared for the marathon. So I just think that if we start early, then we can really help them so that when they get to month 8, month 9, month 10, they're prepared. They're truly prepared. Because right now, a lot of women are showing up and they're not.
They're not. And there's so many things going through my mind. This could be literally a multi-segment podcast episode. And I love you to like with my whole heart. So I want you here always, all the time, because this is a conversation that needs to be ongoing, especially when we start talking. You mentioned social determinants of health. This is not just for the privileged. This is for everybody. There are tons of you out there walking around with smart watches, and just about everybody has an iPhone. Okay. But y'all are walking around with these tools that have capabilities that you are not utilizing.
Yeah.
You can utilize this. Are you tracking your sleep? Do you know what your heart rate looks like? Do you know what your, heart rate variability looks like? Do you know what your stress looks like? I have young ladies track their menstrual cycle. You got a whole cell phone. Let's get you on this app and let's start looking at some trends so we can see over time what normal is for you.
Yes.
All of those things. But again, we have tools. And I would argue that the vast majority of people in the country now have a cell phone.
Yes, absolutely.
Use it. Like, we can use the tools that you have. So there's that. But then there's the other major issue. Again, if you're an elected official, you need to be paying attention. There are a lot of states where Georgia has, gosh, how many states do we have? 100 and I'm drawing a blank. But anyway, there's over 70 something states that don't have counties, over 70 something counties that don't have an OB.
Yes.
Right? We have 150 something, I think, but there's over 70 counties that don't have an OB. And a lot of hospitals in more rural areas are not only closing their maternity departments, they're closing altogether.
Yes.
So now you factor in, it's one thing to say, oh, well, you need to find a provider. But if I've got to go 1, 2, 3+ counties over just to get healthcare, what happens when something pops up?
Mm-hmm.
what happens when we factor in that this is a mom who has other kids? Well, I got to get the kids from school, or I work in this county, one county over, but the next closest county with a healthcare provider is now another 2 counties away.
Yes.
Like,
Yes.
we're not thinking about those types of things as a society and how it is negatively impacting maternal health.
Yes. Yes. Absolutely. Absolutely.
So I think, you know, if you're a provider listening to this, you're an OB-GYN, you need to connect with Operation M.I.S.T, because if you are working in rural healthcare, this is going to help you. And you know why it's going to help you? Because your stress level just went all the way down, because now you monitoring everybody else. Look, you know what's going on in real time all the time. I'm just here trying to help y'all. I'm trying to help you. Don't say nobody told you, because I just told you. But this, oh man, I cannot love this company, this organization more because of the amazing things that you guys are doing.
Thank you. I'm so humble. I'm so humble. And I just think, honestly, because you know that I love you. When you were like, do you want to talk? Yes, I want to talk about anything. I want to talk about everything. But it really is so good. I think when we were at our last talk in Boston, and we got to really see how beautiful it would look. Because for me, so we've created this community where there is a Miss Mom everywhere. So we're in 14 states now, and in 2 countries, 2 other countries. And I think about how we've created these smaller communities. But when we all came together from all over the country for Boston, I was like, this could be a thing.
Mm-hmm.
Where across the nation, across the world, people have access to every discipline they need. I told you I needed a kidney doctor. I needed a social worker, a physical therapist, a doula. I had access to so many people, but it's because I contacted them directly. Do you know how much easier it would have been if my OB was like, man, I really want to help her? The midwife who was with me before, and I'm a huge midwifery model supporter, so I will just go ahead.
You and I both.
So she did so right by me. I am so grateful for her. The OB looked at me, made all the assumptions, and made none of the referrals. So I imagine that I would still be on blood pressure medicine to this day, probably still have kidney problems, really wouldn't be able to have another child if I wanted one, because he didn't do his due diligence to make the connections for me. And so if I didn't know, I could call a kidney doctor and say, hey, will you take me on? And then they say, yeah, I'll get the referral and everything set up. You just come on in. Where would I be? And so we have to be that for people. And so talking to you, who I know you do this day in, day out, you love people the way they're meant to be loved, and you're growing, you're thriving as a result. And so it's just like, if we serve, the people will continue to come. We'll be able to serve more. And that's just my belief. And as long as we, though, compare people to standards, treat them based on protocol, we're going to continue missing things.
That's a big one, because everybody is not equal. Everybody's not the same. We know it inherently, but it's so easy to just, the protocol. Just use the protocol. So easy.
Yeah.
So easy. So if you are a pregnant mom, how do moms get in touch with you?
So they can go onto our website, www.operationmist.org. That's where they will find all the information. If you click join now, it does not actually make you join. It just gives you more information. But if you scroll to the bottom, you can schedule an appointment, and then you'll get a call back so we can figure out if Operation M.I.S.T is a good match for you. And so we do about an hour-long consultation where we just talk, see where you are, what you need, get you with the right plan. We have 4 plans, Operation Sprinkle, Drizzle, Rain, and Mist. And so therefore, pre-pregnancy, whether you need tracking, you just want general health, or you want the pregnancy monitoring, and then just the lifelong connections. And so we just figure out what works best for them. And then we're also on IG, so you could send a DM or whatever on any platform that we're on.
That is amazing. If you are pregnant, you need to reach out. Like now, like yesterday, you need to reach out, because it is so crucial. You want to, just as an individual, it doesn't even need to be a pregnant person. You want to have control over and autonomy over your journey, your healthcare journey, right? And we know that we've got some issues here in this country with regards to healthcare. So don't let the system that's already broken be what dictates your level and standard of care. Like, we've got to start taking some autonomy and taking it back and doing what we can do, right? Do all the things that you can do to make sure that you are also getting the care you need. Be a participant and an advocate in your own care. And Operation M.I.S.T does a great job of coming alongside individuals and allowing them to be able to do that. So from the bottom of my heart, I absolutely love you. I love all that you are doing. I love all that you stand for. And I just need this to blow up some more. Like, forget Operation M.I.S.T. This is going to be like Operation Thunderstorm. Like, we just about to there are no sprinkles here. This is torrential downpour. Okay. Operation Torrential Downpour. That is what we're about to be. Okay. Because this is going to blow up, because this is such a blessing to so many people. If you are a birth worker, a midwife, a doula, a lactation consultant, if you are working with pregnant people, an OB, nurse practitioner, PA, you need to connect with Dr. Sylvester. Don't say I didn't tell you so. I just told you. My little grandma voice. My daughter told me the other day, you sound just like grandma. Okay. Starting to come out. So, yeah. but I thank you so much for all that you do, and just prayers for just continued just blessings and upliftment, because this is such a needed entity.
Thank you. Thank you so much for having me.
For those of you who are listening, if you're now tuning in, I need you to get back to the beginning. Just go all the way back. You will not be sorry. For those of you who are new here, you need more information, definitely reach out to Dr. Sylvester at www.operationmis.com. With any questions, we'll have all that information in the show notes, including social media links and so on. Thank you so much for joining us. If there are other topics that you guys want to hear us discuss on the Pelvic Perspective podcast, we're more than happy to. Definitely just drop us a line, info@thepelvicperspective.com. Let us know, and we'll get some folks on here for you. So thank you so much again for joining us. And until next time, y'all,